As we head up to 10 minutes away from midday this Sunday, I'm Gareth Edwards. Good to be with you. New coronavirus infections in the country have soared to 525 cases. The death toll continues to rise as it reaches the 200 mark. Mahlatse Mahlase is Eyewitness News editor-in-chief. She says it's time to give the disease a more human face. So many countries have put faces and names to the victims of this pandemic, of course, with consent. So is it time to reflect on our own humanity when dealing with COVID-19. Hello to you, Mahlatse. Always a pleasure speaking to you. Many people will know as well, of course, that you're the Sanef chairperson, but in your capacity as EWN editor-in-chief, why is it now time to put a human face to COVID-19? I thought we have been doing that.
I don't think we have done enough. I mean, if you look at the number of people that have tested positive and you look at the number of people that we know where we can put a face to it, it's very, very few people. So we've had the likes of Zolenzima Vavi and then some of the sports people coming out. But by and large, we don't know who are these people. We just know the number. And also look at the death rate. We are now reaching the 200 mark, but only perhaps 1 or 2 people are known to have died of this disease. And what is happening is that people are distancing themselves from the numbers. They are not connecting the numbers and saying these are actually human beings that are actually dying from this disease. And hence I'm saying that it's time to nudge families of those that do die of the disease to actually come forward and say, this is our sister, this is our mother, this is our brother who has died, and they died of the disease. And that's how hopefully we can then get society to start realizing that, this could be me.
Mahlatse, I'm just quoting a piece out of your opinion article, if I may, for a moment. Further down, halfway down, we can, of course, only do this with the consent of the families, but we need to start nudging them. There are going to be questions that even with consent, some would suggest it could be irresponsible considering the stigmatization that we're seeing in some of the informal settlements around COVID.
So I think the learnings here is what happened with how we managed HIV and AIDS. Remember, it was a disease that people did not want to talk about. People were not identified, and what happened was that we saw it spreading. And it was only when we started putting faces to it and people openly having a conversation about the disease, and when we had famous and not so famous people coming out and saying, I tested positive, and I am managing and dealing with the disease in this way, and I am coping. Or when we had the likes of the former president Nelson Mandela coming out and saying his son died of HIV and AIDS, that we started having better conversations and the education messages started driving home. And I think that is where we need to hone in and use that past learning and implement it here with COVID-19. I think what we should never forget with this disease is that we have been told that the first lockdown in terms of level 5 was just about buying time, and we can expect the numbers to increase exponentially. But what we are seeing is that people are not taking personal responsibility. You still find people that are not wearing masks. You still find people that are not washing their hands. You still find people that are standing in close proximity. There's only so much that the government can do. At the end, you and I have the responsibility of protecting ourselves and protecting our fellow South Africans. So we need to start humanizing this disease so that when the government is not there, me and you in our own private and informal spaces can do the right thing.
In the last 2 minutes I have with you, Mahlatse, if I may, there is a concern that many people have raised that when we look at these numbers in South Africa and around the world, it's starting to look a bit like a statistics scoreboard. And that is what I think is what you're trying to get across. Italy, I think you and I will both agree, is a prime example of how to humanize COVID-19 without parading those who have passed who are sick as merely victims that should be forgotten about.
Yeah, and I mean, Italy, you saw in the newspapers where, you had pictures and pictures and pictures of people. They didn't even at the end even have to say that they died of COVID-19, but you could see that this is more deaths than they would have ever seen, and they were able to connect it. But, they memorialized those people, and that's how people connected. And people, if you remember in Italy, at first, people were defying the government regulations. They were just refusing to do what government was was telling them to do. But as more and more people were sadly dying and they were seeing them, that's when they started realizing that this is serious and they need to take action. And then we started seeing more and more people leaving the streets and confining themselves to their homes.
I appreciate your time, and always a pleasure in speaking to you. EWN Editor-in-Chief Mahlatse Mahlase, also you'll know her as the Sanef chairperson, however, speaking to us there.